couple of cases where glean, I think benefit is particularly evident. So first, for men with BPH. So if a man is in urinary retention, we can do a urocuff. We can't get anything out of that because they have to void for it. And so that's not an option. We can do a formal urodynamic study, but everyone hates that test. It takes up a lot of space. Again, like I said, the tests are so user dependent on the technician that I don't even know if I can rely on them. If the catheter is through the urethra and a person can't void, is it because the catheter is in there that they can't void? Is it because of the bladder not working that they can't void? Is it because of the prostatic obstruction that they can't? So a lot of questions were out there. And so a lot of times we were just saying, I'm not sure if it's going to work or not, but let's do a TURP and see what happens. Now I can do a glean and I can know right up front, and here's a couple of examples of that. 2 men, each in urinary retention. I put a glean in one, we go through all the steps, and we demonstrate that the bladder squeezes like crazy, really good bladder pressure, no flow. I know that that is an outlet obstruction. Another patient, we can look at the glean, we see that we put it in, he tries, he strains, we can see Valsalva, we can see cough. Time to urinate, nothing happens. Leave it in for a couple of hours and you see cough, we see Valsalva, no bladder activity. I'll tell that guy, look, you can be on a catheter, we can try a TURP. Your bladder doesn't work, and so a TURP may help, but I certainly am not going to give him the degree of confidence that I would have in somebody with a good, strong bladder contraction. So it doesn't necessarily change what I do, but it certainly changes how I counsel that patient. So there's a really good example there.